Dental caries, commonly known as cavities, are one of the most common oral health problems in North America. Cavities form when bacteria in plaque produce acids that slowly damage the tooth enamel. If left untreated, decay can spread deeper into the tooth, leading to pain, infection, or even tooth loss. Treating cavities early is essential for maintaining long-term oral health. The caries removal process begins with a dental examination. Your dentist will examine your teeth and may take x-rays to determine how far the decay has progressed. Once the area is numb, the dentist carefully removes the decayed portion of the tooth using a dental drill or laser, preserving as much healthy tooth structure as possible. The cavity is then cleaned and shaped in preparation for a filling. Several filling materials are available, including composite resin, amalgam, and ceramic. Your dentist will recommend the best option based on the location and size of the cavity. The filling is placed, shaped, and polished to restore the tooth's natural function and appearance. Most fillings take about 30 to 60 minutes and involve little to no discomfort. Preventing cavities through good oral hygiene and regular dental checkups is the best way to protect your smile.